Hello everyone, my name is Tom Ogo, Deputy Principal, Finance and Administration, KMTC Nakuru. KMTC Nakuru is the second largest college after Nairobi. KMTC Nakuru is located next to the Provincial General Hospital of Nakuru. And the college serves a population of 2,300 and offering different programs. These programs are run through an organized administrative structure. The college is headed by the principal, Mr. John Anyira. And under the principal, we have the head, the deputy principals, academic affairs, administration and finance. And then below that, we have academic and non-academic departments. The academic departments are 10 in number, and they have been, as you will be going through the documentary, you will be able to interact with the academic programs that we offer. We have those departments that support the office of the principal, such as the Department of the College Administrator, Human Resource, the Department of Finance, the Department of Procurement, as well as the Department of Maintenance of our buildings and installations. The college is in the process of hosting one of the most successful Open Day celebrations, which is slotted on Saturday, the 5th of November 2022, starting at 9 a.m. within the college grounds and closing its doors at 3 p.m. Now, on that day, there will be a series of activities which the college has planned. The college has planned, among other activities, to have a procession comprising of the college students going through the old Nairobi Road, through KFA to Kenyatta Avenue, and then coming back through the Molo Line turnoff. During that time, at 9 o'clock, the principal will flag off the activities. And at that time of flagging off the activities, all planned activities will commence. We are going to commence very important activity to the public, which is about we are going to do medical checkup. So we are calling upon members of the public to come for free medical checkup. We are also going to have eye checkup, which is free of charge. We are not going to charge any coin. Alongside that, we are also going to be having displays of our programs. The programs that are being offered by the college, and we are going to be open to the public to interrogate our staff, ask us many questions pertaining to joining instructions, time of applications, when and how to come into KMTC. KMTC, as we have mentioned before, is ISO certified, and KMTC is a national institution. All applications can be done online, and once applications are done, the procedure for application is based on our quality processes and procedures, which are well defined and are available on our website. Those who may be interested may visit the KMTC website and interact more with our programs, the requirements, and the processes. We also want to say that on that day, we are privileged to have our new governor, Her Excellency, the governor of Nakuru County. With her team, we have invited a number of guests to join us during that day. And therefore, we are also inviting members of the public to come and join us on this important event. The college is a strategic government institution which is mandated to train healthcare workers for the benefit of Kenyans, and the college contributes immensely towards the universal health coverage. So as I conclude, I once again want to extend an invitation. Please, members of the public who are within the reach of our catchment, feel free, be welcomed, and feel at home with the family of KMTC Nakuru. Thank you.
My name is Mary Kahiri, Deputy Principal Academic Affairs at KMTC Nakuru campus. This college started in 1969 with one department of nursing. And from 1969 to date, it has really grown. Right now, we are having 10 academic departments and support departments with the current student population of 2,219 students as per this academic year. And the institution is headed by the principal, the deputy principals, HODs, the lecturers, support staff, and so forth. In KMTC, we are guided by policies, and one of the major policies that we have is Students' Handbook. The Student Handbook dictates, is the college rules and regulations that will guide the students when they are here. We also have examination policy, which dictates how to administer the exams. And the programs, we have an academic calendar whereby it runs from the beginning of academic year, and our academic year starts from September to July of the following year. Our academic year is divided into two. We have 2 semesters. First semester starting from September to February, second semester starting from March to July, and student break for their leave when they come here. And as I said, the examination, we are also ISO certified, meaning the KMTC graduates are internationally recognized, regulated by various professional bodies as per department, and above all, KEBS has ISO certified us 9001-2015, and we have our processes which we keep, which we follow to date. For now, we have also partnered with various counties for our practicum of our students. And generally, KMTC Nakuru is the second largest after Nairobi, and we are very proud of it.
I'm Mr. Mdany Sami. I'm the head of department, Health Records and Information Technology here at Nakuru campus. The program was started in 2016 with a pioneer student population of 45 students. And the program takes 3 years, and it has continued to grow as a department. In March 2019, we admitted upgrading class. Upgrading class basically is about students who have done certificate for a period of 2 years, and now they were coming back to do upgrading into diploma. So the program has continued, and currently we have 154 students taking the program. And we boast of Nakuru being a city. We have continued to see the increase in numbers, and more students are interested in this program. And in September 2022, that is in September this year, we admitted 2 intakes. We have a upgrading class of 47 students, and we have basic diploma. That is a pre-service class of 40 students. So all about the program is about in the health sector. Health records and information technology is a key department when it comes to issues of data within the ministry. And across the counties, health records and information personnel are very key when it comes to issues of disease surveillance, coding and indexing of patients' information. And we have seen it is actually one of the pillars, one of the building blocks under the WHO. So health information system is one of the key pillars of health system, and that is why it is one area where the government has actually invested so much. And we have seen as a Kenya Medical Training College, it has continued to support this program because of its importance in the field. Students who join Kenya Medical Training College to pursue health records and information, especially upgrading students, must have undergone 2 years program at certificate level for them to qualify to upgrade into a diploma program under the Kenya Medical Training College. And one of they must have a mean grade of C- at certificate level to pursue a certificate program. And for diploma program, they must have a C-plane mean grade with C-plane in mathematics and C- in chemistry or biology. So that's one of the areas that it's actually key. And we have seen most students actually apply for this program. Right now we have around 5 campuses distributed across the country, offering health records and information technology. We have seen the progress gradually, even in the field, even after the exit. We have seen also, you start from a certificate level, you can progress to a diploma, you can proceed to a diploma degree program, and we have seen even our former students, some we have those who have undergone PhD, and they are now serving in several capacities in Kenya. Currently, we have 2 CEC, that is County Executive Member of County Assemblies, in the County Assemblies and the counties. Those who are in charge of health, we have 2 health records and information personnel who have been selected as county health ministers. And that is one of the areas that we see that it's a strength for the department. And we believe that going forward, the program can offer several opportunities to progress in the career and also to progress in terms of occupation. We have seen that they can work in the health sector, they can work in the private sector, and it's one of the fields that we need to explore, because in the field of health informatics, it's very key. We have seen in the recent past, like in America, we have seen President Obama actually inaugurating electronic medical records to be used in the US. And even equally here in Kenya, it is one of the key areas in the ministry where we have all our students who graduate from this program. They actually be taken through these processes, and some are actually in charge of those program, like electronic health medical records. We have the DHIS, that is District Health Information Software, where all the information regarding patients in the health sector and even the implementing partners are always supporting this program, because it's actually very important for data management. So that is one of the areas that we actually pride in as a department. And going forward, we know our students, we really want to improve on the curriculum so that they become more and more marketable in the field and also have the opportunities within the systems. So that is one of the areas, and we really appreciate. And here in Nakuru, currently I have 5 classes undergoing the program, starting from March 2021 class, and right now we have September intake, that is September 2022. So it's only, we also we have a computer lab in the college where we take students through computer, because this program is about using technology to actually manage patient information. Mostly you will find we have different softwares in our level 6. We have in the national government, actually in the Ministry of Health, through the HIS department, they've come up with a program whereby graduates who graduate from this program are actually fully aware of the challenges facing them in the field. So mostly data management with computer use is actually the way to go. You remember during COVID-19, the issues of telemedicine. We have seen telemedicine using technology to treat patients remotely from wherever they are. Affecting distance is, for example, in a county where we have far to reach areas, we can as well use technology to serve our patients. And that is one of the key areas. And we saw that during COVID-19, it was really, it came in handy, and we appreciate because we are here to support the students, we are mentoring them through the program, and we are determined to make them go through and also achieve the mission of Kenya Medical Training College of offering quality training to our students.
My name is Sophia Kimuke. I'm the head of Department of Nursing in Nakuru campus. And nursing, the diploma, it was started in 1973 with a certificate in enrolled to community nursing, and it continued until 1995 where it was changed to diploma in KRCHN. In nursing department, we have 9 lecturers, 1 secretary and 2 supportive staff. The career progression for nursing is, we can start from enrolled to community nursing, and then you can go to diploma. You can you can either specialize to higher diploma or you can go to degree. Currently, we have a total population of 450 students with 3 programs. The programs, one of the programs is diploma in KRCHN. We have a higher diploma in nephrology nursing, and we have certificate procurating course in KRCHN. The requirements for joining KRCHN is you must have a C plane in the mean grade. Cluster subjects, you are supposed to have a C plane in biology, C plane in English or Kiswahili, or C minus in any one of the sciences or maths. Employment opportunities for our graduates. Our graduates can be employed in NGOs. You can go to county, they can be employed in county hospitals. They can be employed in national hospitals. And currently, there is high demand of nurses who are going outside the country internationally, and they can be employed in the UK, US, Canada, and any other countries outside Kenya. Because of the high demand of nurses in Kenya and outside the country, we encourage a lot of people to join nursing so that we can because of the shortages, we need a lot of nurses to train so that they can go to work in the internationally or even in our county hospitals. And nursing, we train our nursing students theory and practicals. And when we are training our students, we have 2 semesters per year, and the 2 semesters we have theory and practicals. We subject our students to practicals in several areas. We can take them to the county hospitals, our provincial general hospital. We also take them outside our county. Some may go as far as Embu. We can also subject them to Kericho to practice their practicals there. And in nursing, this KRCHN is comprised of 3 sections. We train them in community health, we train them in midwifery, and we train them in surgical nursing. When we talk about the HND nephrology, you can specialize after undergoing the diploma in community health nursing, you can specialize to HND nephrology. And so far we are having the 5th class, which was started in 2018, and now we are having the 5th class. We are graduating next year. And also these graduates of diploma, HND, we also subject them to various practical areas. We take them to Eldoret, we take them to Machakos, and we also train them in our PGH hospital. We have our regulatory body as Nursing Council of Kenya, who controls our training. And per year, we are supposed to admit only 100 students for 2 intakes of March and September. We take March a class of 50, and then in September we take a class of 50. And that is the reason why we don't take more than 50, because Nursing Council are the ones who regulate the college to take only a class of 100 per year.
My name is Ben Yatich, representing our HOD Environmental Health Sciences. In this particular department, currently we have a certificate course in Nakuru KMTC for 2 years program. And the entry requirements, to begin there, the entry requirements for certificate in environmental health, we mean grade D+ in English or Kiswahili, and D plain in biology or biological sciences. And then we also have other requirements, mathematics, D plain in mathematics, additional subjects, also chemistry, physics or physical sciences, agriculture, or also science subjects. For the progression of from certificate course to diploma course, of course, this particular program, diploma course, was started in 1976, thereabout, at the diploma level. By that particular time, it was KMTC Nairobi that was offering diploma course. And then later on, there was therefore a need to roll out to certificate courses, and to roll out in a few MTCs across the country. So from certificate course, they progressed to diploma course by then it was 3 years, having done a certificate course for 2 years, but then currently it was, the curriculum was reviewed, and it was found that it is prudent that there is no need to go for 3 years, but 18 months, that is a 2 years program to diploma. We also have, we have 3 for this particular program, environmental health sciences. We have 3 exit levels. We begin from certificate level, and if one, upon successful completion, one progresses to diploma level for 2 years. And also we have a BSc level, that is a degree. So in that, this program certificate course, for the students, of course, when they come, currently we have a quite number of students. You know, when we talk about public health or rather environmental health, it cuts across the board. We talk about disease prevention, control, and promote health in the communities. And we also venture into research because to prevent diseases, we look at evidence-based medicine. And in terms of the regulatory body, upon completion in whichever level, the exit level, either the certificate level, degree level, or diploma level, they have to do what you call council licensing examination by the council. We have a council called Public Health Officers and Technicians Council, and we also have Association of Public Health Officers. Those are the two bodies that it is within one umbrella that regulates the practice of public health issues in their field, such that, like for example, when it comes to food sciences, and that falls one pillar. We have 5 pillars of environmental health sciences. We have what you call food science, we have built environment, we have public health engineering, we have community health. And when you talk about community health, of course, it cuts across the other cadres. But in respect to public health, our roles, when the crutches, exit KMTC at whichever level, they are going to work in the community with their view to try to prevent, control healthy related diseases. Oh, community health. That is one pillar. It's a very critical pillar in public health, or rather environmental health. It encompasses so many subjects. Quite a number of subjects are under that. I'm not going to probably to mention that. But then the role of this particular environmental health sciences, when they qualify, one of the pillars they are going to do, they are going to work in the field, their roles is to ensure that they prevent, control, and promote health promotion in the community, whether in a healthy school, health education, because, like for example, also we have what we call sanitation. That is another under one pillar, environmental health. We have waste management, which we have also our graduates. They are supposed to ensure that the disposal of waste is safely put in the right place. Also, we talk about also disease surveillance. That's their roles in the field. Immunizations, to name a few. So when our graduates graduate from this institution at whatever level, the employment prospects, they are employed across international, either by the government or NGOs. Even some go into private entrepreneurship, because having graduated from KMTC, having done whichever, exited from whichever level, they are competent enough, because our curriculum is competency-based curriculum, where we envisage that at the end of the program, these graduates, they have the right competencies to really ensure that they do what they are supposed to do in their field. And we want to encourage the community to apply public health, because remember, those people, cadre, you will always get in the community level, at the community very, very level, are public health. And basically, they are the ones who are dealing with healthy of the community.
My name is Philip Nganga. I deputize the head of department clinical medicine, who is away on official duty. In the Department of Clinical Medicine, we have several courses. We have the basic diploma, and then we have the higher national diploma. We have several higher national diplomas. In Nakuru KMTC, we have 3 higher national diplomas, while out in our sister institutions, we have several others higher national diplomas. I believe when this institution was started back in early 70s, the course that were offered here, one of them was clinical medicine, which has been offered since then up to today. But that was the basic clinical medicine, or the basic diploma. But by the year 2004, we started the higher national diploma in anesthesia. And then later, by the year 2019, we started higher national diploma in the ENT and family health, which are in training up to today. Our minimum entry requirement for diploma in clinical medicine is C plane, KSE C plane, and C in biology, or the languages, that is Kiswahili and English, then C minuses in the mathematics and the other sciences, that is chemistry and physical sciences. So once we enroll the basic diploma students, we take them through a course for 3 years, after which we give them an examination. They're so referred to in this institution as final qualifying examination, FQE, and once they certify the board of examiners, we release them to go to practice. And before they are allowed to practice, we have licensing body. In our case, we have clinical officer council is the one that licenses them to go and practice. So they cannot be able to go and practice before they are given that license to go and practice. Where they go and practice in our institutions for 1 year internship, after which now they get employed as qualified clinical officers. During training, we are regulated also by the institution policies, which are formulated by the governing body. We use curriculums that are guided by our governing bodies, and we are also ISO certified, and once in a while we get audited by Kenya Bureau of Standards to see whether we are following our curriculum well and other aspects of training. And we also we partner with our sister institution, the Nakuru Level 5 Teaching and Referral Hospital. That's where we take our students for their clinical experience. It depends on at what level, at whatever level of training. The basic student, probably they do like 2 hours to 3 hours official hours. That does not limit them to going after the training hours. After 5, they can always go to the clinical areas to gain experience. The other higher national diploma, we are with them in class for at least 2 hours or 1.5 hours in the morning. Then the rest of the day, they go give services to the hospital as they gain their experience. When it comes to progression, we are happy to report that our national diplomas can go to do master's courses. That one has been there earlier on, but I think things didn't work out. But this time we were given certification by the Kenya National Qualification Authority, where they equipped our national diploma to degree. So we are hoping that our graduates can access entry points to master's courses in our local universities. Besides that, they can still do other courses. Like they can also join the armed forces for their jobs. They can also join the faith-based organization for employment, or they can further their education in any other areas. I think that is basically what concerns the training and the regulating body.
My name is Monica Maina. I'm the Deputy HOD in the Department of Medical Laboratory Sciences. This is a department that trains the various capacities, competences, when it comes to diagnosing diseases in the hospital. Apart from that, they also help the physicians to monitor treatment and therapies. They also help towards prevention of diseases and better health in the community. This department was started in 1965 as a diploma, 1965, and rolled out to other various hospitals, general hospitals then. Currently in Nakuru, we have diploma in medical laboratory science, and we have 3 classes, or rather a program that runs for 3 years, of which we have about quarter of the time they are away for practical, while 3/4 they are here for theory. So we run the program in such a way we have theory and practicum running concurrently so that our students come out when they have all the competencies. This is a department that has 8 departments within it, which is a very good indicator in our markets. So currently we have hematology, which deals with blood, clinical chemistry, about body fluids and analysis. We also have blood transfusion, which is a very key department, even in our hospitals, because it deals with transfusion of blood and blood products. We also have microbiology, virology. We also have what we call parasitology. All these departments are very key because even when it comes to our markets, in the job market, it tends also to expand our capacities, because we can get into jobs in the research, because we can also do our jobs in the hospitals, we can also do our jobs in the NGOs, and even in the forensic laboratories which are coming up. This course is actually regulated by a body that is called Kenya Medical Laboratory Technicians and Technologists Board, which regulates the training of students. It also oversees the curriculum. It also oversees the trainers so that they are competent enough and licensed to train in that particular course. And also, it also monitors the private entities, the businesses that people can put up that concern the medical laboratory. Also the reagents that come into the market so that they are not of bad quality, because that will ensure that the quality of tests that are done in hospitals are good. Then we also have the entry points to get into this course. We have the mean grade of C. We have English or Kiswahili, C stand also. Then biology, C stand. Chemistry, C stand. Then we also have either physics or maths with a C stand. So you see, this course is a very good course because the doctor cannot work without a guidance. rather without identifying the actual problem or the actual disease that is ailing the patient. And that is where now the medical lab comes in and gives quality results, so that as the doctor treats or gives therapy, he knows maybe the amount of drugs to use or even the kind of drugs to use on the patient.
My name's Dr. Wilson Kipsangrop. I'm the Deputy HOD, Pharmacy Department. Pharmacy Department in Nakuru currently has a population of about 380 students spread over 3 classes. Our class has a capacity of 50 students according to regulatory body, and the entry requirement for pharmacy are like for laboratory sciences. That is a mean grade of C-plane, and C-plane in biology, C-plane in mathematics or physics, C-plane in one of the languages, English, Kiswahili, and a C-plane in chemistry. Once we admit our students, the first thing we do, we index them. Pharmacy and Poison Board gives them a number for monitoring purposes. We take our students through a 3-year course. First year mainly entails foundational courses, which is preparing them for professional courses in second year and third year. So in first year, they mainly deal with chemistries, anatomies, physiology. And in second year and third year, they deal with the provisional courses, that is pharmacology, which is basically the effects of drugs in the body, and also what the body does to the drugs, and other courses like medicinal chemistry, pharmacognosy, which is the study of medicine from plants and natural resources. They also do practical. We teach them practicals as well as theory. In third year, we send them away for a whole semester, 37 months, to the field for clinical attachment and also industrial attachment. We send them to pharmaceutical industry for at least 1 month so that they can participate in the manufacturing process of drugs. They also go to community pharmacy where they dispense drugs to the community, and also they go to the hospital for at least 3 or 4 months. Once they are back, they sit for an exam, which is known as final qualifying exams, and if they pass, they graduate as pharmaceutical technologists. But they cannot be allowed to practice until they sit another board exam from Pharmacy and Poison Board. If they pass that exams, they are now enrolled, and they are allowed now to practice pharmacy. However, they cannot practice on their own until 3 years elapse. So after 3 years, they can now superintend. Basically, pharmacy entails provision of medicines to the patients and then ensuring they get the best use out of it. In terms of employment, they have a wide choice. We have about 6 branches of pharmacy. We have hospital pharmacy. We have community pharmacy. We have forensic pharmacy. We have compounding. We have industrial pharmacy. In hospital pharmacy, which is the major one, they deal with the provision of drugs, both to inpatient and outpatient. They're also part of a healthcare team. They participate because healthcare is like a system. It entails collaboration with other colleagues. They provide information to prescribers on rational use of drugs, new drugs which have entered the market, adjustment of doses, and management of unexpected reaction of drugs. In the retail pharmacy, it is divided into 2. We have community pharmacy and we have wholesale pharmacy, which again is actually filling the prescription, advising the patient on preventive ways and proper ways of using medicine. Compounding is a new field of pharmacy, which actually entails individualizing treatment of patients. Actually, there is nothing like an ideal dose. It is only we generalized. In sensitive cases like chemotherapy, we need to adjust the dose accurately to a patient. And we may have to do some compounding. Most of the skin diseases, again, they are unique. Some preparations which are not commercially available, are prepared. Other areas include research, whereby they are done in the pharmaceutical industry in search of new molecules. They are also done in research institutions such as KMTC. So those are available opportunities for our graduates. I also need to talk about education. They can participate in education after enhancing their training. In terms of career provision, we offer higher diploma in pharmacy. So far, we have higher diploma in clinical pharmacy, which is offered in Nairobi and Mombasa. We have 6 campuses actually, which train pharmacy in KMTC. Among the 71 colleges, we have 6 which offers pharmacy. Nakuru is one of them, which is the second largest. We have Nairobi, we have Machakos, we have Nyeri, Kisumu, and Mombasa. We are also in the process of introducing another course, HND, known as Alternative Medicine and Pharmacology. Our students can also pursue the common HND, like HSM and health education. So the field for employment is wide in pharmacy. I encourage the public to persuade their children to pursue this course because it is very useful. Thank you very much.
My name is Clement Murevi. I'm the head of department, Dental Technology, Nakuru campus. Dental technology started in 1968 started by British Corps and Seychelles nationalists before it was given back to us as African. Dental technology involves design, fabrication of oral and maxillofacial prostheses. Diploma course is a 3-year course, and the requirements are C as aggregate in KCC, then C in biology, C in physics or mathematics, and C in physics. The programs go for 3 years, and the first year we give foundation courses in relation to dental technology, and as you advance, the program becomes a bit advanced. We start with simple to complex, and there are 4 disciplines in dental technology. We have orthodontics, where it deals with alignment of crooked teeth. Then we have crown and bridge, where we do fixed teeth. Then we also have the removable dentures that are done by general public. Those when you lose all teeth, we may give all or one. Then we also do what we call maxillofacial dentistry, where we give artificial nose, eyes, and ears, and even part of the cheeks. The course is intensive, and 75% of the course is done in the lab, and have 2 modes of teaching. When you leave, go to the class for maybe for 2 hours. The next, you have to go for demo in the lab. The courses have specialization. As you want to advance when you're through with the diploma, you can advance locally and internationally. But when it comes to employment, the most students are employed by the national government, county government, and you can also employ yourself. The course is very helpful in the community, because when you lose 1 or 2 teeth, or your teeth are not straight, they are crooked, you can visit one of us.
My name is Sheila Kwamboka. I'm a lecturer in nursing, and in Nakuru KMTC, I'm also the Dean of Students. I'm going to speak about my roles as a dean. I coordinate student activities within the college. Nakuru KMTC alone has an estimate population of slightly above 2,000 students, cutting across all departments. And my role as a dean is to coordinate the activities of the students. I work with a technical team of student leaders who have been elected by the students and known as the SRC, the Student Representative Council. And I coordinate these activities by liaising with the deputy principals in various departmental committees as well as college committees, such as the College Disciplinary Committee, the College Examination Committee, as well as the Management Committee. My role basically also involves offering psychosocial support to the students, whereby I link these students with a team of counselors, both within the college and outside. We have professionally trained counselors within our staff, as well as the youth-friendly counseling team in the Nakuru Level 5 hospital. So I link my students who have psychosocial issues with them. And for those who need more support, we also get the support of the parents so that the students can be assisted. Our vision in KMTC is training students as well as developing them to become competent health professionals. So through my office, I mainly work in the issue of developing students, whereby we also encourage the students to participate in various activities while they're in college. We have clubs and societies within the college, like we have the football club, the basketball club, we have the drama club, we also have the karate club. We also have several other sports activities that are ongoing. So we encourage students to participate in these activities so that we mentor them and we develop them psychosocially so that they become competent health professionals. My office also encourages community participation. We have a commissioner among the Student Representative Council who does community work, who is in charge of medical and community work, whereby we link with other stakeholders and we participate in community activities outside the college, such as spreading information that are relevant, especially relating to health activities, and also carrying out outreaches, and also actively participating in some of the activities relating to health information.
I'm Carolina Makobe. I'm a librarian by profession, and on behalf of Head of Department, who is out on official duties, I'm here to represent the department. KMTC Library Department was established the moment the college came to existence, and it has been in existence since then. We have several services that we do offer. We offer reference services where we give information as per our clients' needs. The information they want on short term, we offer them, and long term, we do still offer the information. We also offer referral services. In case we do not have the information material that our client is looking for, we usually refer them to institutions like Kenya National Libraries so that they can be able to access information. We also offer interlibrary loan services, whereby when our clients or our student visits other KMTC's libraries and they find an information material which is very useful, relevant to them, but we do not have it here, as a library department, we usually assist them to be able to access that information by borrowing on their behalf. Another service that we do offer is circulation service. This is whereby our students and staff come in, they borrow information material which they can access outside the library. We do provide a conducive study environment where we have a seating capacity of 300 and we have well modern study carrels. We do have information material, both print and non-print, where physical books, which are print information material, are over 6,000, and specifically we have material on medical information. Since the institution basic offers medical information as a training, so our information material that we offer basically are medical information material. Our acquisition of information material is conducted by the subject specialists, we librarian, and our students. We do incorporate them so that we can acquire the most relevant and current information material. So KMTC Nakuru, within our town and across, we do have the best relevant, current, and health information material, both print and non-print. Non-print information, we do have a computer lab within the library department where we allow our students to be able to access information in non-print media that's online. We do have a stable Wi-Fi and internet connectivity. We allow our students to carry their laptops so that they can be able to access information online. And we have created sites for students to be able to access information online, sites like Hinari, UpToDate, health.com, Moyo Clinic, among other sites. Currently, we are enrolling students to be able to access information online in the site of UpToDate because it's specifically offering health information material, and students are able to access the most current and relevant information. One of our objectives as a library, as a department, is to meet or improve user satisfaction by 5%. So that is why currently we are really encouraging our users to move online. We are actually availing current information and the most relevant to our students. In our library, we do, our doors are open from Monday to Friday from 8 a.m. to 7 p.m. and on Saturdays from 9 a.m. to 12 noon. So once our students, we receive them, you do not have to pay any membership fee. Our library is open to you and you are encouraged to come in anytime and any moment freely to access information. You do not pay anything.
I'm HOD, Department of Orthopedic and Trauma Medicine, which is being offered in this campus. I'm running 2 programs. The department has certificates in orthopedics and trauma medicine, and also diploma in diploma in orthopedic and trauma medicine again, upgrading. So we have a total of 230 students in the campus. The program was initiated in this campus in 2019 with upgrading, diploma in upgrading, and now it has it's also offering the certificate program, which is running on all together. This program is this department is key in the hospital. They are actually dealing with emergency cases, especially the trauma and orthopedics. In the hospital, they are actually based more in emergency department, like casualty. In the casualty, they have where we receive trauma patients, like for the road traffic accidents. Those are the patients that we normally check on. We also deal with orthopedic cases, the one that is congenital, so that we can correct them in a way. So there's a process on how to correct. So basically, that is the main roles of our students, I mean our graduates. So the graduates they can be employed anywhere, even in sports medicine. They can where they have the trainers, they know how to train on anything on injuries, and even to alleviate, that is on rehabilitation. So that is a lot the main roles that they have. There are also officers in operations, like in orthopedic operations, like in theater, they normally participate in correction, yeah, of those elements of injuries like fractures and other spinal conditions. That is much that we do.
My name is Irene Makendo, and I'm the head of department physiotherapy. So physiotherapy started in this college in 2012, and it has been around for the last 10 years. So basically what we do in physiotherapy is we treat conditions using physical means rather than using drugs and maybe surgery. Some of the things we use for treatment are things like heat, cold therapy, and we also use massage and also exercises, which is very important. Now, after our students are done with KMTC, they go to various areas of employment. First, they may be employed as in sports teams. That is what we do in sports. And they can also open their own clinics, and the most important ones, they work in the hospital. And they can also get involved in research, especially in those conditions, long-term conditions, for example, multiple sclerosis, or things like stroke, which is also the main thing we do in physiotherapy. Now, career progression, after they are done with a diploma here, students can as well go and do a higher diploma in physiotherapy. One of the areas is what we term as OMT, which is orthopedic manual therapy. We do studies in women health, which is very important, especially for childbearing age. And then we do what we term as gerontology, that is studies for the old people. And we also do for CBR, that's community-based rehabilitation. For you to join in KMTC to do physiotherapy, you have to have at least a C plane as the minimum qualification, with a C plane in English, Kiswahili, a C minus in mathematics. If you don't have maths, then you have to have physics, which has to have a C minus. And also you have to have a C minus in chemistry, and also Kiswahili. And biology, very important. You also have to have at least a C plane.
My name is Jacinta Gashemi. I'm here to represent the Department of Radiography and Imaging. This is a diagnostic department in KMTC. What we mean by diagnostic is that it helps the clinicians to be able to determine what is wrong with the patient's body. So it's diagnostic. It's involved in carrying out investigations for clinical purposes. So in KMTC, we have a diploma in radiography and imaging. This is here in Nakuru. We have only diploma, but in other campuses like Nairobi and Kisumu, we have higher diploma in ultrasound. In Nairobi, we have higher diploma in radiotherapy. We have higher diploma in CT scan and MRI. We also have a short course that is echocardiography. So this course is a very marketable course. It's one of the greatest inventions in diagnosis in the clinical setup.
So we are proud to say that without radiography and imaging, then the clinical setup will not function accurately. So we are here to welcome all students who would want to join us in this specific course. Our main grade is C, and particularly C in English, physics, biology, and chemistry. So those are the main line in where we actually look at when we are trying to get recruiting students to join us. So as I've said, that it's a very marketable course. Most of our, in Nakuru, we have had 2 classes graduate. All of them, I'm confident to say that are already absorbed in the job market, because it's a very advanced or evolving job. So we are involved in job creation, and we ensure that most of our students are able to get jobs in the job market and even overseas. So the good thing about a diploma in radiography and imaging is that you can always advance and do your degree. You can always specialize in the various aspects. You can specialize in the radiotherapy. You can specialize in the MRI, that is magnetic resonance and imaging. You can specialize in computed tomography. You can even specialize in cardiac sonography and even in just general sonography. So the opportunities are so many for the students who are looking into joining us in KMTC, and we would urge all of them who are interested that they come in and join us here in KMTC. The prospects are even outside Kenya and in the UK and in the US. And we are very proud to say that we even have students from our graduating class that have progressed to work overseas. So I would urge all students or anyone who would be interested to come and partake this course to join us and be part of our team.
Yeah, I'm Alex Kipchorono, the Organizing Secretary, Student Representative Council, a student from the Department of Dental Technology, second year, second semester. As SRC, that is Student Representative Council, it's a council comprising of 15 members, and among them, the Executive Committee, 5 who are Chairman, Vice Chair. We have the Secretary General, Treasurer, and Organizing Secretary. We also have 8 commissioners and 2 non-official members who are the Auditor General and the Speaker of the council. And our role as the SRC is to represent the students, or airing out or being the bridge between the administration and the students. And we are working under the Dean of Students as the council. And then the roles of the chairman also is being the most senior, is chairing each and every meeting, and also is the one to approve each and every plans that the committee or the council has for the students. As the Student Representative Council also, we have plans. We lay down the plans for the students. As the Student Representative Council, we usually lay down a plan for the student activities, such as the cultural and festival event. We also have the sports and entertainment. We also conduct community events, like going to outside the community and offering them some services as the students. And that's how the institution benefit our communities. And each and every student, as they are admitted into the institution, they pay 1,500 shillings for the council. And this 1,500 shillings is used to facilitate each and every event for these students. And again, these students, some of this money is secluded by the council for the support of any needy student. Because in our institution, we have some students who are in need of some support, like financing them in terms of school fees, or a student might have the school fees, but in terms of now food, maybe the student has sponsorship for the school fees, but the food, he doesn't have any source. So we support them as the SRC Council by allocating them some money. And again, for you to qualify to be a member of the Student Representative Council, you must undergo a vetting by the administration under the academic. You must be also disciplined. For you to be a student representative member, you must be disciplined. You must also be a good performer in terms of academics, because you cannot lead the students, and when it comes to academically, you are a poor performer. So chances of being a poor performer in also leadership is high, and therefore you must be a good performer, disciplined student for you to qualify to be a member of the Student Representative Council. And again, our commissioners have responsibilities. We have the commissioner in charge of hostels, female. We have a commissioner in charge of hostels, male. Those are the people who air out issues of students concerning their accommodation within the institution. Whenever there is any challenge, any arising issue in the hostels, they are the first respondents. Also, we have a commissioner in charge of sports, and among them is my brother here, Jefferson. He is in charge of sports and entertainment. Each and every activity concerning sports and entertainment, he's in charge. He also lays down each and every plan concerning sports. And again, we have a commissioner in charge of medical and health affairs of students. So he's the council member who is in charge of all the health issues of the students. Whenever there is any student who falls sick within the school, when it is off days where the administration are not around, he is also the first respondent to be responsible in ensuring that the student is being taken to hospital and his health is being taken care of. Also, we have a commissioner. We have other commissioners who have their own responsibilities also. And more so, my responsibility as the organizing secretary, I usually organize each and every activity that is supposed to take off within the institution, especially for the benefit of the students. We organize for them. We also air out the issues of the students to the administration so that we can come out to a solution and ensure that the academic journey of the students within our institution is smooth, and each and every student achieve the desires of his or her heart in terms of academics. And here also is an ex-official and a colleague. He is our Auditor General. He is Simon Mwangi.